and it's 5:31. Do we have a quorum?
To start, how many commissioners do you need?
We have 1,
1, 2,
3,
4, 5.
yeah. Jerry, you there? Jerry, okay.
Is there 11 that we need? So if we have at least
We need to have 6, I think, right?
Six.
Is that right? Is that right?
We do have quorum. We need 6 to begin.
Okay,
Thank
Okay.
you, Colleen. Okay, my first meeting, so please bear with me. I'm gonna do roll call. And we have Colleen
Present.
Rodriguez, myself, Nancy Cadena. Nancy, she's here.
I'm here. Sorry.
Brianna Stein. Gerardo Montemayor. Maybe she's here today, no, right? Elizabeth Alonso,
present.
Mara Mendez, Jose Gonzalez, Jessie Hernandez, and Margarita Garza. Who else is here today? Chief Maciel.
Good afternoon, Chief Maciel, Laredo Police.
Okay. Mr. Moss, Tiffany. And I think
Yep.
Anna.
Good afternoon, Guillermo Walls from the Health Department, and with me is Erica Lopez.
Hi.
Okay, is there, let me move on. Is there any public comments? Oh. Going once,
No.
No.
going twice, no? Okay, let's move on to the approval of minutes for March 9, 2022. And we have
I took a look, and if there's no changes, I make a motion to approve.
I second that.
to administrator report. I know we do have a report from Mr. Jesse Hernandez. Go ahead and go over there, Mr. Hernandez.
Treatment committee had a meeting on, I want to say it was 3/21 when we had the meeting. And we discussed different things. What I did was for your review, because there was a question that, there was a question that came up a couple of months ago about whether this was going to be a true medical detox or some other social type of model. And we've always, from day one, said it was going to be a medical model. And so one of the things that I sent you all for your review, so that you all know the rules that are applicable to detox, is Chapter 448, the requirements for detoxification services. In this particular Chapter 448 rule for detox, it really outlines exactly what we need to have, or what the agency, whoever's going to be running it, will need to have. This is just for clarification for the county, city, that we're going to have that. This type of, it's going to be a medical detox with a doctor and nurses and staff to make sure that we have to support the facility. We discussed how we're going to start off probably with a 22-bed unit. It's going to be a 46-bed unit, if I'm not mistaken, Is that not correct, Guillermo? 23 pod with two people in, two clients in each pod. So that's a total of 46, but we'll start off with a 22-bed unit. And eventually some of those pods will be adolescents, but mostly adults. We're going to do a medical detox with the Chapter 448 as per the Texas Administrative Code. We talked about how it's being built so that licensure could be made easier. So it's going to be built to the specs for licensure. We discussed how there is some initial funding already from the city and the county, but that we want to get buy-in from the hospitals, from the different entities. When we were doing the first, back in 2013, 2014, when we were doing the first stab at the detox, we had buy-in from the hospitals, and they were some of the last group stand. With the funding, and of course, we're going to do different things to fund it, go after grants. And, we discussed how at one point in time we might set up a 501(c), kind of like Austin did, to go after grants. Of course, obviously, the city or the county will have nothing to do with running the facility. It's going to go out for bids. But anyway, that's essentially what we discussed. We discussed the type of clients that we're getting. We discussed the issue of Vivitrol, that we want to be able to, we approve Vivitrol as one of the medications that would be used. So, for example, we have opiate addicts. They'll go through detox. We'll put them through a period of crisis stabilization. So at the 14th day, we give them an injection and then pass them to one of the outpatient services, whether it be scan, pillar, but they will at least not overdose and die after their detox. And so we'll start off with Vivitrol. The other thing is, of course, we could start alcoholics, the ones that have severe alcohol use disorder, with Vivitrol. That will help them get into recovery. So right now, really, the only outpatient services we have are SCAN, and they have both state and SAMHSA funded, and we have Pillar, who has only SAMHSA funded. But our capacity isn't quite that large, and all of our services are being overwhelmed by quadrant 4 clients, those that have more severe substance use and more address that, and Dora can address that. But that was the discussion we had a few weeks ago. Do you all have any questions? I believe, go ahead.
I just want to clarify, it's a 24-bed facility right now.
Well, oh, that's 48, 24 bed? I thought it was 23. I thought it was 23 pods with two for each people. Are you saying 24 beds?
Beds, 24 pods, one person in a bed probably. I'll double check, but that's where we're at this today.
Okay, so I thought it was 23 pods, according to the notes that we had. So 24 beds. Okay.
24 beds, yes.
Okay, very good. All right. Thank you.
I have a question, Dr. Sylvia Dominguez.
Oh, hi, Sylvia.
Hi. What are the age ranges?
Well, we've talked about both having a detox primarily for adults, and that's going to fill up pretty quickly because we don't have it. But we want to make eventually some room for adolescents. I mean, when and Kiki can attest to this because he worked with me when we were at that time. We had a detox facility. The only detox facility we ever had for adolescents was at SCAN. And it was full 100% of the time. And primarily we saw heroin addicts. We had the highest rate of adolescent heroin users in the state of Texas being admitted to our detox facility. And so it's expensive to run, you break even, but we'll eventually hopefully have some adolescents. But I can let you know right off the bat, just with the waiting list that I see in the drug court, the waiting list that I know that SCAN probably has, and Pillar, the number of people that are coming in that need detox, like it'll get filled with adults. But you know, we talked about having adolescents in there, so I don't know what the split's going to be. It has to be up to the way it's designed, and I would imagine the agency that's going to take it on, because that's a big liability to have adolescents and adults. You know, so I know that we can be done based on the way I saw the cost, but I don't know. Hopefully that answers your question.
So are we looking at 18 and over?
For adults, it's 18 and over. If you're looking at adolescents, you're looking at 13 to 17, but we actually had a 12-year-old heroin addict in our detox facility at SCAN. So, you know, they're kind of like adults. They would allow you to do it, but we don't know exactly how, if we're going to do adolescents. We know for sure we need it for the adults, because we haven't had one in a long time here in Laredo.
Okay, thank you.
Okay, we're gonna go to Guillermo Walls. Do you have a report, Mr. Walls?
I do. I have two items actually. I'm gonna skip to the second one first because this goes along with what Jesse was talking about. This morning at the health department, Congressman Henry Cuellar did provide $2 million to the city of Laredo for purposes of detox funding. So that's a great leap for us. So that solidifies everything that we had hoped for. So I'm sure you guys will see that in the news and probably in the paper tomorrow. Second thing, the county of Webb County has at the last commissioner's court meeting, they went ahead and approved Nathan Bratton, who's an attorney slash one of the Webb County administrators, to go ahead and draft a 5-year lease with the city of Laredo at $1 a year for the facility. We all knew it was coming. This is really not big news, but you know, the good thing is everything is starting to fall into place in terms of solid paper-based solidification. So they're working on finalizing their permits, but in conversation with the contractor, Mr. Bratton told me that they're looking at 308 calendar days from completion of construction. So as soon as the county sends the draft over, which I don't imagine will pass next Friday, the city will review it. The city will send it to city council, and we'll be up and running. So it's things are really starting to move now. So thank you, Jesse, for your report there and for the words you say. All this is going hand in hand, which is great.
Thank you. I wanted to piggyback on something you said. One of the things that I mentioned, we had talked about having a report ready for the city council. And I had talked to Nate, and then whatever report I have, I'll pass it on to him, because the Hidina wanted that. But this is the top. And on the other hand, you know, with Henry awarding or making sure that the city gets this $2 million, this is just a side note, or $2 million, right?
2 million.
It's a side note. The reason why we had a detox on Laredo was because of Henry. He went ahead and put a rider on Takata's funding, and he was the one that got the detox here in Laredo, because we had such a high incident of adolescent heroin use in Laredo. You know, all of our clients had hepatitis C and B, or both, right? but it was called, our detox program called the Henry Cuellar Youth Center, because he was able to get the funding and he put the rider in there. So he got the funding for the adolescent detox, and now he apparently helping out with this particular issue. So thank you very much, Henry.
Absolutely.
And that's all I have for my report, ma'am.
Thank you.
Thank you very much. We're gonna go to our next item. It's a discussion and possible action. Presentation by subcommittee on recommendations to city county model of detox. Is that what we just went through?
Is this to make a presentation?
Well, it says on the agenda, it says presentation by subcommittee on recommendation to city, but I think we just discussed it.
We discussed it, but the plan was, from what I understood from Pauline, was that I would draft that report. Part of it would include chapter 448 of what it was, so that there would be no question, and that's what Nathan wanted. He wanted to make sure, Mr. Brad wanted to make sure that there was no question that it was going to be a medical detox facility. Apparently that question came up months ago, and we met as committee, the Drug and Alcohol Commission, and we met in committee, and we said, this is what it is. That's why I provided chapter 448 to you.
Okay.
So yeah, eventually, I guess somebody will make a presentation to the council saying this is what we're doing.
You?
Well, I'm going to go ahead and draft out the letter, and I'll send it off to you.
All right. Well, I'll make a motion to approve that. I think it's a very good idea. We need to get our recommendations as a commission across, especially of what I've been hearing on repeating and emphasizing that it'll be a detox center, not just a drop off, but like a medical facility.
Yeah, we don't want to have to drop off like in San Antonio,
Right.
dropping off homeless,
Yeah.
interesting facility, but no, yeah.
Okay, great. And then on item 6, it says detox
Do
facility.
you need do you need a second for that or what? Is this a motion on the floor?
Well, I would second it,
Yes.
I'll second it.
Okay.
Everybody in favor?
Aye.
Anybody opposed? Great. Okay, the next item, it says the detox facility update, and I think we covered that. I don't know if anybody wants to add anything there. Come to our community presentation. We have Orgullo of Laredo Youth and Safe Haven. We have Mr. Earl Medina with us. He's gonna talk about his organization. Your turn, Earl.
Oh, you're muted.
Can't hear you.
Can you unmute? We can't, oh, there we go.
Oh, really? I can't hear.
I can't hear. Maybe your volume.
I think you can call it in, Earl, if you want to. There's a number there. Sorry, it's his first time doing this. Earl, can you hear us? Let me see. Let me send them the phone number. I'm so sorry.
No problem.
Things like this happen all the time.
Okay, let me see if you can call this number.
Excuse me a bit, I'll be right back.
Okay. Okay, he's gonna call it in.
All right. I don't know if y'all could hear me now.
Yes.
All right. Okay. Sorry about that, guys. Technical difficulties with my laptop. It's brand new and I'm trying to get used to it. So please bear with me. My name is Earl Medina. I'm the founder and president for Orgullo Laredo Youth and Safe Haven here in Laredo, Texas. We're a nonprofit organization that I just created 2 months ago, to be honest. As you all know, what our organization is more of, as you all know, that we're here today to discuss the importance of drug and alcohol overdose awareness. At Orgullo Laredo, we share the same beliefs and feel that this topic hits home and happens more often than not with the LGBT community as well. We believe that we're a united community. We need to be mindful on how we approach some cases when it comes to this matter. As our Laredo community continues to grow, as we see the increasing cases within the LGBT community, youth and adults, the reason is the involvement of substance abuse is due to many reasons. For example, depression, lack of acceptance, and bullying. For example, there have been many cases that have escalated to suicide, which why Orgullo Laredo is here today. We're here to help to advocate, to be the strong voice, not only to the LGBT community, but to every person that comes to us. Orgullo Laredo Youth and Safe Haven offers 24-hour life coach sessions with our master certified life coach, Jorge Dove, which is from Austin, Texas, as well as partners that we have not only with the City of Laredo Let's program, but also with many organizations in the city, but also out of town. What our organization focus is to the teenagers. As you all know and are aware that nowadays, any kid, no matter if they're gay, straight, lesbians, any type of gender or ethnic, they get bullied. They get the lack of acceptance from their parents, from their friends, from any individual. They go through a depression. That's where they get involved into using these substances as drugs and alcohol. That's why sometimes these cases lead to overdoses, that we sometimes are not there to take care or hear them out. So this is what our organization here in Orgullo Laredo offers for the teenagers that are wanting to be heard, wanting to have somebody to be there and give them the opportunity that we're here to protect them, guide them, and coach them to the abilities that we can. Sooner or later, as when our branch grows a little bit more and our community hears more about Orgullo Laredo, that's where we stretch out our safe haven part. This is where we open our doors and we try to get a facility to at least create a community service for anyone that is welcome, or for there to be support for what they're looking for. What we're here today to discuss is about drugs and substance. You know, it all goes into play. Who we approach, who do we send them to? And this is where Orgullo Laredo would like to collaborate with a lot of organizations and a lot of committees around the city so we could guide these kids and any adult to the right people. We want them to hear our voice. We want them to hear that we care about them and never shut their doors. So I leave this with a small quote that someone wrote for us that I was very precious, because this was from an 11-year-old girl from United South Middle School. And it starts with, love is patient, love is kind. It does not envy, it does not boast. It is not proud, it does not dishonor others. It is not self-seeking. It is not easily angered. It keeps no record of wrongs. Love does not delight in evil, but rejoices with the truth. It is always protected, always trusted, always hope, and always preserve. I want to thank everybody for giving me the chance to speak with you guys, and hope we have the opportunity to work with one another and help each other make our community a little bit safer. Does anyone have any questions for me?
What kind of do you provide, if any? And what do we do to help you with other providers?
Yes.
So I was just wondering what services you provide, agency, and what you do to help link up the provider.
So one thing that we can help to provide one another is just having the resources out there to help guide these students, let's be honest, to be there, to know what can we do to protect them. In other words, who could be there to give them the counseling that they need and the support that they need. You know, teaming up with the city of Laredo, you know, with as much help that we can, could always help us ensure that we're keeping our community safe and we're aware of what we could try to avoid in the future. So that's all I ask from everybody, is just the support to guide us. And one thing that we ask is the protection, because it's very hard to be openly, let's say openly gay in Laredo, because I'm not trying to put Laredo down, but we're still a little conservative city. But we want to accept these kids because they want their voice heard. And when people find out that they're gay, they're lesbians, they like to wear makeup or anything, and people make fun of them, their parents don't accept them because, yes, we are a city that still has kind of, what can we use that term, machismo? That it's very hard for some of these kids to come out to their parents and not have the support of their parents to be there for them. And we want to make sure that we could guide them, give them the protection that they need and the support that they could have. And that's why we created this organization in Laredo, because it's very hard for us to get our voice heard from the help of the city. And that's why we want to make sure that we have the trust and the support of everyone that we can.
Well,
I
you know,
have a question.
Yes.
Do you have an office location, or how do you operate, or do you have a website, or where can people call you, or are you doing a campaign for, listing a number where, folks can call you?
Yes, we do have a website available. It's orgulloLaredo.com. It's recently created. You're able to see what we have to offer, as well as meeting our board members in the organization. Right now, we're trying to create a pamphlet so we could go ahead and distribute around any events that we get invited. So right now, we're asking for everybody to please visit our website and give us some insight of how we could help the society in Laredo to become better, as well as get the advice not just only from our board members, but anybody in the community that have experience or have any questions that they want us to help out, so we could be a united community.
So you have a place there on the website that has a section on where we can contact or write any comments? Yes?
Yes, ma'am. You could write a
Okay.
comment. It gets straight sent to our email, as well as it has my business number. We don't have a location yet. Like I said, this baby is barely 2 months old, and we're growing it as fast as we can with the support of a lot of teachers, counselors, as well as parents of teenagers that want us to build this organization. But yes, we have our contact information there, as well as our email, and as well as a section that they could send out a comment, and we're more than welcome to reach out to them.
Okay.
you know, Earl, I think that not only committee, but Laredo welcomes what you're doing, working with the LGBTQ plus community. It's interesting, Dora and I worked at a facility back in the 80s, and in 88, my actually first adolescent with co-occurring issues. And so just to provide you some information, we have SCAN that provides services for adolescents, and they have licensed counselors. We have Pillar that provides services for adolescents, and they have licensed counselors. And both pretty much can be our one-stop shops. I just wanted to provide you some statistics of the adults, because those adolescents eventually transition to adulthood. And in one of the SAMHSA grants, that I evaluate, just real quickly here, this is in Pillars program, 251 adults, primarily male, gay individuals have been served, and there's comprehensive behavioral health, medication. They do comprehensive prevention. They do testing, and the statistics show that about they all have co-occurring disorders. About 59% of them, the primary substance that they use is alcohol. And we're going to find a lot of adolescents using alcohol. I'm sure the scan they have the same number. Another about 24-25% of adults that get into this program are using cannabis, a smaller number with cocaine, about 4% with opiates. But they all start off, as you said, Earl, with some mental health issues, depression, because you know the way the community is, the way our Hispanic culture is, they're not accepting, and they go through a lot of the LGBTQ plus community goes through a very tough time. So whatever it is we can do to help you all, I'll be I'll be happy to help you. Feel free to text me, call me at my cell phone number 956-337. Wonderful services. I know that they're providing wonderful services, and we're all for what you're doing. Congratulations on what you accomplished.
No, and I thank everybody for hearing me out. And yes, we're here to help out everybody and be the support and the pillar of the community. And especially like you said, like it all starts with our young people and it grows into being adults. And we're here to guide them in the right path than going the wrong direction. And that's something that they need to have their voice heard. And that's where Orgullo Laredo Youth and Safe Haven is here to support them with whatever we can and with the support of the community. And I thank each and every one of you for your support.
Earl, if I can make a comment, you might want to reach out to the CAPS unit at Border Region, their community partners. They might also be able to refer you individuals that are currently going through the coming out process. So you guys might also be a referral for them. So the CAPS unit, the peer providers at Border Region would be a good one as well.
Without a doubt, CAPS, good service.
Thank you.
Hey, I tried accessing orgullolaredo.org, but nothing comes out unless I'm typing it in wrong.
I think she's
.com.
Yeah.
It's .com.
.com. Okay. All right.
Yes.
And Earl, my name's Guillermo Walls. I'm one of the assistant directors with the health department. We're going to reach out to you next week on Tuesday to meet with you, see what we can do to collaborate. Next month is a big month for the community, and so we'll be delighted to share resources and get you into the net and see what else we can do to work together. Thank you.
No, I appreciate it, Guillermo, and I've already I worked with Richard Chamberlain last year when we hosted our gala with Laredo Pride, as well as with Erica Dominguez as well. So I'll be more than welcome to meet with all of you so we could go ahead and sit down and see what we could do.
Excellent. Looking forward to meeting you.
And
Thank
for
you.
those of there's a lot of people that don't realize there's still people that are actively contacting HIV. We don't think of it much. We've gone into the COVID, but just last month out of 21 clients that were tested that came into the health services at Pillar, one of them was HIV positive. And I'm sure that Guillermo can tell you that we have a lot of positives still coming in the city.
Yes, that is correct. Our HIV cases have been growing here in the city, especially a lot of them have been the age variant has been between the ages of 19, between 23-year-olds that we've been hearing a lot of cases that have been creating, and that is something that we're trying to help out and give them the sources of where they could feel comfortable going to get tested, whether it's Pillar, whether it's the City of Laredo LES program, to get that support, because some of them are afraid to get tested, and we're here to coach them and give them the guidance. And hopefully, like I mentioned, in the near future, we could create a community center that we could have volunteers that can come in, and if they want to get tested where they feel more safe, we have those options for them to feel safe in a community center here in Laredo. And hopefully we could get that growing.
Well, congratulations. I'm very, very happy for what you're doing.
Thank you. Any other questions?
Anything else, guys? Well, thank you, Earl, for your presentation. It was awesome. I was telling Earl, if he wants to come in every month like I did and possibly become a member also. So just so you all know,
Well,
he's willing to accept that, so.
we love that.
See,
Have, and as far as I know, and Guillermo, you can correct me if I'm wrong, there's still vacancies available, you know.
Yeah.
We have at least 3 that I know of.
Yes.
Yes, you're come, the more the merrier, you know, you bring a different aspect to our group that we need, a much needed aspect.
And I'm more than welcome to get an opportunity to join the group and, you know, share all the expertise and I guess my life stories with everybody and be there to support the cases that arise here in Laredo. So if there's always an opportunity, I am more than welcome to join the committee.
Yeah. All right.
Well, thank you very much, Earl. We're gonna move
Thank
on
you.
to our stakeholder agency updates. Any updates from anybody?
well, I traveled to Chicago. I attended the Lifesavers Conference. It is amazing how a lot of agencies, law enforcement, nonprofits, everyone just comes together, does all these, does all this work for the community, whether volunteering, whether through agency, sharing stories, seeing how we can make our, you know, our streets, our, you know, our habits, you know, driving, you know, better. And I really appreciated everybody that was there. I enjoyed visiting all the vendors, because since now that that COVID is ended, and actually I was supposed to be doing a presentation at one of the judge's office today, but LAD does plan to get some equipment so that we can use also for show and tell, you know, especially now that the prom season is coming around, and, you know, to reach out to our youth in schools. I mean, you know, if we can just save at least one family from having to go through the grief of, you know, whether it's overdose, drunk driving, whatever the case, you know, if we can reach out and save at least one person, we'll never know. But what we say, everybody here as a group, and all the outreach that we do, we might be I'm pretty sure we are saving people, because I've had folks come up to me and say, you know what, I drink alcohol. I don't promise you I'll stop drinking, but I promise after hearing you, I'm not gonna get behind the wheel. To me, that is more than, you know, it's worth all the grief that I go through when I present, because it gets emotional. But if we can have that impact on any person, I mean, it's well worth, you know, everything that everybody does here. I appreciate all of you all for doing the work that you do, and we just need to continue. And I'm happy to be part of the commission. Thank you.
Thank you, Mr. Alonso. Thank you very much. Anybody else? Go ahead. We can't hear you. Ms. Ramirez, can you turn on your mic? There we go.
Can you hear me now?
Yes,
Hi,
ma'am.
Dora.
There you go. Hi, I'm sorry. I apologize for that.
Okay.
I got excited. I want to make an announcement now. This is Donna Ramirez to every month send representative to be part of the DAC. So this what I want to announce is that two events. SCAN is hosting a family separation in the context of immigration and illnesses. They're going to be offering free CEUs, and it's going to be on Tuesday, April the 26th. If you visit our website, I believe you can register or you can call in and see you want to be part of this. It's free, and I believe it's free. Don't quote me on that, but I just want to say that it's on our website. It's going to be on Tuesday, April the 26th, and it sounds very interesting that we're going to have two presenters. One is from the justice system, and the other one is our presenter who's going to be providing all this information, especially how it has an impact on early childhood mental health from prevention to intervention. So I think it's something really, really important for those professionals that would like to earn free CEUs. That's one that's happening on April the 26th. You can visit our website. And the other thing that SCAN has been helping out every year, twice a year, is in the collaboration with the DEA, the Take Back Pill. It's going to happen on April the 30th. We're encouraging anyone that has any unused or expired medication to please go to this dropout places that they're going to have. I believe they're going to have two locations. Veronica will be emailing you a flyer. And the one thing that they're having this year, they're going to go ahead and be collecting also e-cigarettes and vaping devices can be disposed at the locations. The only thing that the DEA is not going to do, they're not going to be removing the battery. So I guess if you want to hold on to the battery, hold on to the battery. But this is the first that they've said that they're collecting e-cigarettes and vaping devices. I know we're having a lot of issues. A lot of students in many of the both school districts are being caught with vaping devices, and they're not only, it's vaping, but actually it's marijuana. They have one was about the wax, one was about the THC. So we're encouraging you to talk to your family members, spread the word that this is going to happen on April the 30th, and we want to make sure we remove any.
Dora, where is the workshop going to be at on the 26th? I saw it come up.
On the 26th, yes. Give me a second, Jesse.
Maybe you can send it to
Yes.
Mr. Ross also so they can distribute it. But
Okay, yes, I'll go ahead and have Veronica email you the flyer, Jesse. I'll send it, make sure you all get it. I was trying to get a hold of Veronica, but I think she was in one of the presentations. But definitely, I will have them email you the flyer so that you all can spread the word. It does say that for more information, it just says for more information, please contact. Let's see, if you register here, you can click on the website and you can register. It doesn't say where it's going to be held.
Yeah, I that's what I was asking because I saw
Yes.
it, and I didn't know if it was going to be hybrid, live, or virtual, or just virtual.
Okay.
Didn't know
Okay.
what it was going to be, but it's okay. I'll call them up.
Okay. Thank you, Jesse. I'm sorry about that. Yes, I was hoping that Veronica, could have joined us, but today she had a very busy day. But I wanted just to make sure that people are aware that we're having this. It's a webinar. I apologize. It's a webinar registration.
Oh, it's a webinar. Okay.
Yes. So even better, there'll be social distancing and everything. So we just want to make sure that people are aware that they can, listen to this, especially because those of us that work with, children and youth, and especially with the mental health, it's been an issue. It's been something that's been coming up more and more often with the whole pandemic. So thank you all for allowing me to say these two announcements.
thank you very much, Ms. Ramirez.
Thank you.
I have an announcement. The Volunteer Services Council for Border Region they're gonna be having the Administrative Professionals Day Luncheon and Fashion Show. That's gonna be on Wednesday, April the 27th. It's gonna be at 11:30. And we still have about 7 tables of or if you all want to get a ticket, that's $75 each. You can let me know. Or out to Mr. Walls, and I'll send it again so you can distribute it also, just a reminder. Okay. And if there's anything else anybody wants to add? Okay, well, it's to
Just happy Easter to everybody.
Happy
yes,
Easter.
happy Easter. Be safe,
Be
everybody.
safe.
Yes.
Yeah.
Do I get a motion to adjourn?
Motion to adjourn.
Second.
Okay.
Bye.
Thank you very
Be
much.
Good seeing you all.
everybody.
Take care.
Okay.
Thank
Bye-bye.
you.